we go. Hello, Sarah. How are you?
Hello, it's nice to meet you.
It's nice to meet you too. We did some like emailing, and then it's always nice to see there's like a real
I
person
know.
behind like the email.
I agree, it is very nice.
So I want to talk to you about a couple of
Mhm.
things. I want to talk to you about dialectical behavioral
Yeah,
therapy. I want to talk to you about anxiety, and I want to talk to you about borderline personality
you
disorder.
got it.
Um, so I want to first ask you like just a little bit about
Mhm.
you, like where you went to school, what got you into therapy, like what created this therapist that we see today.
Okay, sounds like a plan, I can absolutely help you with that. So you asked me about school. I went to undergrad at, Susquehanna University, and I got my, BA in psych, and then I went immediately to, LaSalle University for my master's degree, so I have an MA in, clinical counseling. Um, and then I went even further so I could get my licensure. So like there's additional stuff that you need to do in order to be able to take the licensing exam and do all the things. So that way you can actually be a licensed professional counselor, which is what I have now. So yeah. Um, it was a long journey. A good journey, a long one. So you asked me how I got to you mean therapy in general or mental health like what or how did I become like specialized in what I do?
Yeah, so I'm curious about first of all, I want to acknowledge you said that it's a long journey, and yes it is because I have like 2 months left of my journey and it's been oh my gosh, like I feel like I've been like running forever.
I
So
know.
you could not be more right about that. I'm interested though in what made you wanna say, like, "I think I wanna do therapy. Like, I think I wanna become a counselor myself." Is there anything that stands out, or was there an aha moment, or I don't know, anything that you were like, "You know what? I think I'm gonna do this."
I mean, I think I've always wanted to do psychology, right? I think when I was younger, um I remember back in high school, I thought that I wanted to do work with I'm gonna say Silence of the Lambs. I wanted to be Jodie Foster, but not carry a gun. I just wanted to work with like the really scary yeah, no. And then like
I wanna be Jodie Foster, but just because I wanna be Jodie
I
Foster.
know, I know. So, and I think over the years, just life lessons and having experience working with different kinds of people and, in college and grad school, like I purposely had a lot of different experiences, right? So I was working full time while I was going to grad school. And that was incredibly helpful because some people hadn't had work experience. So it took me a little bit longer just because I was working and then going to school and then getting your doing your internship. So I was basically working two full-time jobs for and being paid for one. Um, so I kind of dipped my toes into a variety of things, like kind of, I thought, okay, well, maybe I want to work in a corporate business setting and do some organizational thing. I don't want to do that. Then I thought, well, maybe I want to work with children. And I tried that and I'm like, ooh, yeah, no, I like children. I just, uh, you have to find
It's
what
a
works,
special
right?
yeah. Mhm.
So, life happened. It just I'm in my 40s, right? So like all of this was kind of shaping and molding like when I was like going to school. So I was in my 20s and then going over my master's degree. I had a daughter, like all this stuff, right? And a lot of just trial and error for what I liked. I worked in some community settings doing really frontline type of work while I was getting my master's degree. Times where I used to get, like beat on regularly, and that was part of the thing. That was part of the journey, right? And I thought it was big shit making $10.50 an hour, and that was with combat pay, right? So it was like, so, and then, there was times where I spent quite a many years working for the state hospital system. And I thought at that point, I was like, oh, I really want to work with really seriously mentally ill individuals. I loved it. And what had happened was I worked for the state hospital in Harrisburg. They were closing. I was part of helping people to close. I was part of the group that like ended up transferring to Warnersville because where I live, it was kind of like in the middle at that point. And I loved it. And what had happened was new administration came in, new people, and the climate just changed, right? Like the one thing that I can always I'm grateful for is the state hospital. They were the ones that got me my training in dialectical behavior therapy, right? Like that and doing that, I will forever be grateful for, even though I thought a lot of the other stuff was shitty and I didn't like. Yeah, things change, right? Like organizations, like whether it's community, any kind of government, it changes, right? And part of that's part of the process, and it's kind of like, okay, this is kind of how you gain your purpose. It's kind of like, okay, you take the shit, and it's completely shitty while it's happening, right? And as you go through it, you're like, holy cow, like this is actually opening doors for me, right? So when I was working with the state, I really thought, oh my gosh, I really like people with BPD, right? And now, like, BPD is a range, right? Like, the people that I worked with at the state hospital level are a lot different than the people I work with now, right? It is, I very much feel that it is a spectrum, you know? Ended up leaving the state, and I was doing some outpatient stuff for a local agency. And while I really liked it, my daughter was little. And when you work with community run agencies, they're working on budgets, they're working on, even if they are for profit, okay, there's still a lot of things that happen you don't even realize are happening because you're kind of the bottom of the totem pole, right? You just like are doing this thing, right?
Mhm.
And again, as much as I really liked it, there were pieces I didn't like, and I ended up being laid off. I suspect it was because I suggested I would like to become part-time, because at that point we were seeing a shit ton of people like every day. Like it was kind of ridiculous. I don't know how people do it now, right? So anyway, I got a great experience there, which I'm very grateful for. And I'm like, I really like doing outpatient. This is kind of my like bag. I like this. And going back to work, I was, toying around with working for different places, and I was like, what am I doing? Like, I ended up doing my own practice, right? I found some amazing people that help therapists in private practice. And I was like, holy shit, I didn't know this was even a thing. So I found them, and they were incredibly helpful. So fast forward to now. Okay. It's been since 2018 that I've been running my own practice, and I could not be any happier. I wouldn't have gotten here without all the other stuff, right? It's kind of like it's like you kind of have to go through the shit sometimes to get to where you really want to be. That's how I
Yeah,
came
and
to this
you have
place.
a lot of experiences too, and it sounds like you worked in a lot of different
Yeah.
settings. It's interesting, I was just talking to I have, like, my clinical supervisor who worked in community mental health for, like, 10, 12 years,
Hmm.
who was just commenting on, like, the benefits of community mental health are, like, learning how to write, like, a perfect note, for insurance
Yeah.
is one of them. But, like, just a lot of the benefits is you become really, really resilient in, like, your counseling
Hmm.
and the things you can handle a lot of
Hmm.
things, I think is kind of what I've heard from her. Um, yeah, and so that range of experiences that you're talking about, that stuff, um, yeah, it seems like now you're on the other side of it, you're like, "This is where I'm
It's like,
like,
thank
I did that
God.
to get here."
You know
Mhm.
what I mean? There's a reason why burnout is a thing. You know what I mean? Because
Mhm.
everyone talks about it, and yet no one wants to kind of do the things that are necessary to not have burnout, you know? So
Mhm.
I think it's incredibly important um, to experience being in the trenches, right? And knowing when it's time to perhaps shift and do something else.
Mhm. Yeah. Yeah, that's really wow, I wanna clip that and just, like, listen to that all the time. So I wanna shift and ask you a little bit, you
Mhm.
mentioned your training in dialectical behavioral
Mhm.
therapy. So, this is something that I've been hearing about hearing a lot recently, just, like, amongst people in the field,
Sure.
is about DBT.
Mhm.
So I'm curious about what is like kind of from your perspective, like what is dialectical behavioral therapy? If I can say it.
It's fine. It's a mouthful, which is why people just say DBT, right? Um, so in a nutshell, it is a very complex treatment for very complex people and problems, right? And when we talk about what is DBT, right? There's a lot of different components and pieces, right? It was initially created for people with BPD, with like serious emotionally dysregulated behavior, right? And that's still the the gold standard for people with BPD. But what it is, right? There's like some, the it's for people that have it's an effective treatment for people that have difficulty controlling their behaviors and emotions. Okay. So what it does is it aims to replace problem behaviors with skillful behaviors. Okay. It helps people experience a wide range of emotions without necessarily acting on those emotions, right? Because most people don't want to experience the negative stuff, right? So it helps people be able to experience the range of emotions without necessarily acting on it, because it's the acting on stuff that gets the rap or BPD. Okay. It also helps people navigate relationships in the context of their environment. And what it does is the hallmark of it, the overall goal is it helps people create a life that's worth living, right? No one wants to be in a life that they're just existing, right? This is one where they're creating one that they want to be part of. Okay. So when I talk to people about what that like dialectical means, right? Because most people are like, I don't know what that means. So what it means in a nut, like bare bones, right? It's the idea that two very opposite ideas can be true at the same time, and when considered together, create a whole new truth and a new way of viewing any situation. All right. So there is always, always, always more than one way to think about something, to think about a situation. Does that give you kind of like a nutshell of like what it does?
Yeah, can we play with that for a
Sure.
second? So if I say something like, my friend texted me and said, I'm going to be late.
Hmm.
And I read it and say, he's pissed at me
Hmm.
and he's going to be late because because I said something yesterday and he didn't like that. So I feel this intense emotion of he's going to be late because, and he
Hmm.
didn't say anything else. He didn't say, I'm sorry. He didn't say, is that okay?
Hmm.
That's all he said to
Hmm.
me. He's being very short with me. So that's how I'm interpreting this situation. So basically, is DBT, this is my guess, saying, let's look at that feeling, but then let's also look at like a possibility of what's happening. Is that near it or did I
It's a
miss it
part,
completely?
right?
Okay.
Because okay, so here's the thing. Like I'm gonna guess that you know about cognitive behavioral therapy. Okay,
Mhm.
so this is what makes, in my belief, right, what makes DBT different. Okay. A lot of different therapy modalities, right? Let me step back. People come to me and what their experience has been or what they've heard of therapy is this. They've either been in therapy and they're like, oh my gosh, my therapist was so nice. This person really got me. I felt heard. And then I was like, well, now are you going to help me with my problem? Okay. On the other hand, right? Some people, they've come to me and they're like, I had this therapist and there was like no compassion. They were just telling me I had to think differently and I would feel better. I say sometimes shit is just shit. And there's no like changing, right? Like
Mhm.
we can't just think more positively out of something when someone has died, for instance.
Mhm.
Like that's not helpful.
Yeah.
Like, or
Sometimes you're gonna feel bad because it feels bad. Yeah.
yes, yes. So like the idea
Mhm.
here is like the when I talk about balance, like when I look at two very opposing things, so we look at acceptance. So accepting where the clients are at and also moving for change too, right? So when you're talking about, let's say you got a text from your friend, the friend like whatever, I don't know what this was going to be late or was late and didn't apologize. Is that what okay.
Mhm.
So that would be the change piece, like looking at, okay, what are all the different pieces here? right? DBT is also validating the, oh my God, that really sucks that that person canceled on you. It's not saying, well, maybe they didn't mean it. We don't know. Maybe they did, maybe they didn't, right? That's part of the change about tweaking, like looking at all the facts, like, what do we know about this? And also validating that person, like you, getting that text and thinking that maybe they're angry with you. Does that make sense?
So when yes, so when we have someone who has borderline personality
Uh-huh.
disorder, right,
Uh-huh.
BPD, um, and we're experiencing like a really intense emotional reaction. What we're doing with DBT is we are saying, okay, let's see what we're having here, and then let's look at like the possibilities of the situation. One is, yeah, that doesn't feel good that happened.
Uh-huh.
And then acknowledging other things. Is that kind of, did I miss
Yeah,
it, or
yeah,
is that
yeah.
okay?
I mean, like, so let me tell you this. Okay, so like like I said, there's like a lot of different pieces and parts. Okay, and I'm kind of going around to kind of answer your question. Okay,
Mhm.
um, so what is the philosophy? Like, what are the different pieces? Okay, so yeah, DBT is absolutely, like I said, it's supportive. Okay, a lot of people initially, when Marsha Linehan, like the founder, created DBT, a lot of people were like, okay, it's suicide prevention. And no, no, no. No one wants to just exist and be miserable. Like, so it's supportive. It's like, okay, how do we create this life that's worth living? Okay. DBT is also behavioral. Okay. So this you'll probably already be familiar with. It's like looking at analyzing problem behavior. And with people with BPD, it could be something like yeah, it could be cutting, it could be rage texting, it could be you know, going on a bender. It could be any, it doesn't even have to be that critical either. You know what I mean? We analyze problem behavior patterns. Okay. And then we look at replacing problem behavior with skillful behavior. And that's where the skills training piece comes from in DBT. Okay. So there's also a cognitive piece, kind of like what you initially said, right? That's like the basic cognitive behavioral stuff comes from. It's looking at, being able to change beliefs, expectations, assumptions that were once helpful and no longer effective, right? So then there's the skill oriented piece. Again, it's helping people enhance what they've already got or teach them skills that they were never taught to begin with. Okay. So that, and I'm like, I feel like when I talk about DBT, I get really passionate. So I kind of like, I word vomit. So,
It's honestly, it's so perfect. Mhm.
okay. So like I said, it also balances the big dialectic here is balancing accept and change. Like I already explained, accepting where you're at and also helping you make changes. Okay. And the last piece is collaboration. So what that means is we work together to help you, the client, get to where you want to be. So I often share the metaphor with my clients like, okay, so this is what this means. Let's say we're in a rowboat in the middle of this big honking huge lake. Your goals are at the other side of the lake. Okay. My job is not sitting back, just directing you. You need to row faster. You need to do it that way, this, that way. And, like just giving directives and do. It's also not you, client's job to have me do all the rowing, and when I turn my back, you're burrowing a hole in the boat. Do you see what I'm saying? Like we're both,
Mhm.
you can imagine. So we're both
Yes.
working towards that. So there are all these different pieces. So now when you asked about your phone call, like the phone, the text or whatever, right? Like there's a lot of different ways to even approach that. I hope I'm answering your question because there's a lot
You
it's a
are.
very it's a complex treatment, right? Like it's
Mhm.
not something, and that's where a lot of times insurance companies, they won't pay for it, right? Because they want something that's going to be quick and quick. There are some faster therapies for people that don't have as complex issues, right? That are going to be kind of faster. And that's just not it takes a long time because depending how old the
Mm.
person is, they've had that many years to get where they're at. It's not going to take 10 sessions to undo all that, you know?
Yeah. And it's interesting though that you bring up an interesting concept about first of all, I want to acknowledge something. You mentioned, one person doing all the work
Mhm.
essentially. And it's funny that you say that because I was just having a question. I'm in my internship. I was just having a question with my supervisor where we talk about clients and she's gotten really good at saying like you're doing too much work. When you come into the session, I think especially as like a younger therapist and you feel like, "Oh, I have to like, I have to really row."
Mhm.
And so I think for me, it's been an interesting balance of realizing, okay, I'm doing too much work in this session. So it's really interesting that you brought that up, and I'm really glad that you brought that up.
Sure, absolutely. We've all struggled with that, right? Like,
Mhm,
when you kinda notice,
yeah,
like, you kinda get like, "Why am I working harder than the person?" Right? Because
mhm, yeah, and I'm just like going and going, and I'm like, wait a minute, I need to like take a step back here. But it's interesting. I want to shift like just a second to anxiety for just a little
Mhm.
bit, and we'll probably go 360 back to
Sure.
like borderline personality disorder or BP. But I'm interested in anxiety and DBT.
Okay.
So I'm curious about like, is there anything that's, like, coming up for you when I say, like, anxiety and dialectical behavioral therapy? Like, is there anything that is, like, sticking out? Because it's interesting because I think when I think of anxiety and again, a lot of my thinking is from a textbook right now,
Sure.
right? Like, um, I'm thinking, like, CBT.
Mhm.
I'm thinking calming techniques,
Sure.
and, which if we're being honest, like, I think is, like, a lot of horse shit.
Mhm.
I don't wanna be whatever, but if I'm having a panic attack and you give me like you pass me a worksheet that says here's a breathing
Mhm.
technique, I'm gonna be like, go fuck
Mhm.
yourself. And that has happened in my own therapy. I was nicer about it, but I was like, I'm not gonna like breathe. Like I'm having a panic attack. I'm
Yeah.
curious about. No, yeah,
No,
go
I
ahead.
was
Were you
just
gonna
gonna say
give
because you're
your
not able to think clearly when you're having a fucking panic attack, right? Like,
right?
that's just
Yeah,
ho that's
exactly.
how it is, okay?
Yeah.
So what stands apart, right, is in DBT, it's not necessarily remember, this is the acceptance piece that I'm gonna be sharing, right? Like, sometimes you gotta ride it out, like, being able to accept before you can even, like, do anything to change it. So what I'm saying is learning how to tolerate the distress, right? So we all have trouble at times. We all have to deal with tolerating distress, right? And yet not everyone was taught how to do it. And depending what's going on, like I haven't been able to tolerate stuff sometimes. We've all lost our shit, right? You can ask my vacuum cleaner that I tossed out in the yard several years ago. It happened, right? Like so
hmm
I mean, to be real here, right? Because like for a therapist to be like, well, you need to do this, that, and there. Yeah, it's horse shit, right? People mean well. So sometimes, and I use like DBT is very specific that it's important to use personal examples of how we ourselves are skillful, right? So I have to giggle at like some of the some of the examples I've used, but like um for instance, if someone's panicking, right? Like one of the DBT skills that in learning how to tolerate distress, right? You can do that. And when we're tolerating distress, it can mean anything from like, oh my God, I need to make take care of this problem right here, right now, when now is just not the time to do it. So kind of going back when you're having a panic attack, right? It's kind of like I talk to people about subjective units of distress, right? I don't know if you've ever heard of that before, but it's like when it's like 0 to 100, right? And 100 is like the worst
hmm
possible thing ever. You cannot tolerate crap. Okay. When you're feeling to get about like 70, 75, you're not thinking clearly. So you're not going to be able to be like, okay, I need to do this, I need to check the facts behind this if this is because you're not absorbing the information, right? So how do I teach clients to tolerate that so that way they can become more skillful? So first, we need to learn how to activate that part of our nervous system that's going to calm us down quick, right? And it turns out that there's several things that work really, really fast. And one is cold temperature, right? This is kind of like a thing that's going around a lot on social media or like TikTok about cold, right? But the reality is it works, right? So, I mean, I can remember, when my daughter was just little and like most little kids, they'll like have moments. They're going to have temper. That's how it is. And she was crying and carrying on. And I was like, I can help you. You need to listen to me though. I can help you. Just, and I got out a bag of frozen vegetables. I said, you hold this until you can't anymore. Okay. Now it took about 30 seconds or even less. Right. And she'd like, you could see the breathing calm down. And then she finally looked at me and said, I don't understand how holding a bag of frozen vegetables is going to help me. Right. And I said, you're able to talk to me now. Right. Like,
Mhm.
in other words, cold temperature is going to jumpstart that parasympathetic nervous system that's going to calm you down faster so that way you can think clearly, right? I mean, that's like one of the easiest hacks to do, you know what I mean? But it's practical.
Mhm.
Um,
And you almost always have access to something
mhm,
very cold.
mhm,
Mhm.
you got it.
That's interesting. I wanna, so basically it's kind of this is kind of what I just interpreted just a minute ago was, when someone's in a panic mindset,
Mhm,
someone is actively
mhm,
panicking, they are out of their distress
mhm.
tolerance. So, using, like, logic with them is probably not gonna be super impactful.
No, they're just
Um
not. They're using their lizard brain. Like it's
Mhm.
not going to compute.
Yeah, so what you're talking about is basically, bringing them into increasing their window of tolerance
Yeah.
basically is kind of
At
where
that
you're
point,
going.
yep, yep, yeah.
Yeah, that's what I was kind of interpreting was, acknowledging like they're out of it.
Mhm,
So you're saying, okay, something cold, that is an example of bringing them like back to,
mhm,
out of lizard brain and back to human brain.
mhm.
Um, and then with work kind of increasing that window of tolerance that they have to where they can stay in the logical brain when they start to feel panic, when they
Yeah.
start to feel anxiety coming
Yeah.
on.
And part of being like I like what you said because you need to be aware when stuff is happening, right? So a lot of times with like people with panic, right? And and in DBT in general, like the biggest piece that I teach people first and foremost in skills training, right? The first module that we even talk about is core mindfulness skills because being aware of vulnerabilities, being aware of our bodily cues when we're starting to get ramped up, right? Because if you can get it before it gets to that 70 or above, right? You're not going to need to use certain things like it's helping to be more skillful, right? So the awareness, right, can be extraordinarily helpful. Being able to know, okay, what are things that typically rise my anxiety, like make my anxiety get high? What are some of um uh, like what are some of my bodily cues, right? We spend a long time listening to, okay, so where do we talk about where does the anxiety live in your body? Okay. What do you notice happening as you start to ramp up, right? Because there's going to be signs all along the way. And with someone with that anxiety or people in general, no one really pays attention to that. Okay. So a lot of it's being like, okay, like let's step back and observe this as pay attention. Does that make sense?
Yeah, so that's interesting you're talking about like that beginning of anxiety treatment
Hmm.
of um where we start is basically learning ourselves. Is basically like when someone's coming in with panic or they have extreme anxiety, it's what in my body, where is this coming from, in
Hmm.
my body? What kind of bodily things are triggering it?
Hmm.
I know for some people it's like when the heart rate gets up a little bit, that can be a trigger. And so it's interesting you're talking about just kind of learning ourselves. When you work with clients with this, do you see them kind of like learn about their own body and learn about like it's interesting, I guess, because if you don't have, like, an extreme anxiety, you don't really think about it, right? You're just kind of functioning, and I feel like the anxiety might bring a certain level of awareness about yourself, like, what things are being triggered in me? What behaviors make me feel anxious? And then I don't know, I don't know, I don't know if I'm, like, picking up on anything, but it just feels like there's, like, an more of, like, an intimate knowledge that you have to learn about yourself and your
Yeah.
inner workings when it comes to having, like, an issue with anxiety.
Oh my gosh, yes. Like I worked with people and I have friends that are police officers. I have friends that are in like really high stress jobs. And like there are people that will literally talk themselves into having a panic attack because they'll have a very normal like body sensation. And because they've had panic attacks before, they'll be like, holy shit, it's happening. Right. And it could be just because they were doing something completely normal that would raise the heart rate. Right. Um, I have several people in my life and clients that's a thing, right? And I can see why it would happen. Like, it makes sense.
Yeah, it's interesting. I'm wondering, do you ever see someone that comes to you with a certain level of anxiety that you're like, maybe, this is specifically tied to a certain trauma, and if you had maybe if you treated this trauma, you would see the anxiety symptoms kind of like go away.
Did you say trauma?
Yeah, so
Yes.
basically, what I'm kind of getting at, I have a friend of mine who does ART, accelerated resolution therapy,
Mhm.
and she has a client that was having continuous panic attacks, like every day she was having panic attacks, and it was tied to a specific traumatic event.
Mhm.
So they did ART, and they saw that this individual who was having panic attacks every day was now not having panic attacks at all.
Mm.
And I know that's I want to clarify and say I know that's a little bit different from like some situations. I'm just thinking about like in your experience, have you had anyone that you feel like the anxiety was tied to a very, very specific thing?
One of the reasons,
I don't know.
like, no, and that's a great question. When I said about how DBT is behavioral, right? And we do behavioral analysis, right? So, like, problem behavior, like if someone has a panic attack and they don't know why, like, so DBT assumes that there is always like DBT tells us that there's a cause for everything. Doesn't matter what. We might not know what the cause is, right? So a lot of times, like, when something happens and they're like, I don't know, it just kind of happened. Then it might take a whole session to like really, and it's, um, to put it simply, like, we do behavior chains. It's almost like if you think of dominoes lined up and you knock one over and it kind of starts this reaction. It's kind of like, okay, what started that first domino push, right? So it could be a thought, it could be a sensation, it could be a person, it could be basically, it could be all kinds of things, right? But what like, what can happen is, as we get accustomed to doing these and I really get to know the client and they get to kind of know like what to expect and kind of like what to look for, and they're already becoming more aware, um they become, you can kind of sometimes see a pattern, right? Not always, you know, but sometimes you can really, really see what might start a particular like issue. For instance, like going back to your text example, right? I have people that if they feel that they've been um like blown off, okay, or ghosted or whatever, like their first thing is like, they'll go to like the texting and like rapidly fire like I don't know how many like rageful texts, right? you know we can all admit that that's not effective, right? And it kind of makes you feel worse after the fact. So a lot of times it might look at, okay, was was it a thought that I had about this? Like, did I interpret this in a way that's causing me to, then experience something painful? And I don't want to deal with the pain, right? So I'm going to be doing whatever the thing is, like rage texting, right? And I feel better for like a brief second, right? So a lot of times, with anxiety too, like you can really kind of isolate, and there is some generalized pieces, not always, yeah. I have a client now who's a college student, and anytime there's like a possible like body sensation that could be interpreted as like something really, really bad is going to happen, right? Like, it becomes a panic, right? What we've also
Mm,
noticed was sometimes he wasn't eating properly in the morning. So like his glucose was dropping. So he was interpreting like that lightheadedness as like a panic attack happening, right? So there are a lot of different pieces and parts, but it's fascinating though,
right, yeah, or you have maybe you like turn a certain way and you get a sharp pain very quickly,
Mhm.
and then you're like, and then your brain goes, "Oh no, this is it. I'm gonna have like a heart attack, or
Yeah.
I'm gonna have," and then it kind of spirals from there.
Mhm.
Just like misinterpreting like a simple normal bodily function
Uh-huh.
for something really, really,
Oh
dramatic,
my gosh, yes.
or
And I
terrible.
mean, let's be real here. Anxiety, any kind of emotions, right? They're purposeful. Like, we have them for reasons, right? They're like, they communicate to us, right? Anxiety is there to alert us to potential danger. Like, it is needed, you know? It's ruling out like, are you objectively safe right now? Versus, is there really a thing that's called, do you really need to listen to it right now?
Yeah. Um, yeah, that's super fascinating. I remember actually in undergrad psychology, I had a professor who was talking about in my abnormal psychology
Mhm,
class, talking about kind of that misinterpretation.
mhm,
And, some people that, if they work out or they do something that increases their heart rate, they become anxious
mhm,
because they're kind of misinterpreting
mhm.
it as that's interesting. I want to ask you like one more thing before I go into like our final question.
Sure.
Um, After working with people with borderline personality disorder so much, like, what do you think? There's a lot of misunderstandings around BPD,
Mhm,
and there's a lot of reactions that people have to people with
mhm,
BPD. I'm curious about like if you could like verbalize or try to say like what it feels like for a person to have BPD. Basically, what I'm getting at is like cultivating like trying to help people cultivate a little bit of acceptance for people with BPD because I think we see certain behaviors and reactions and we like immediately either reject them or we're scared of them
mhm.
maybe. I'm curious like what do you think that feels like to a person with BPD when they have certain reactions that they do or when their emotions are becoming so powerful?
Yeah, no, that's a great question. And it's a very valid one too, because I'm going to, again, real talk, like people that have BPD, a lot of times do things that are really obnoxious. I mean, we all do, really, you know what I mean? Again, I can understand why it pushes people away sometimes. And so, okay, so people that have BPD, okay, and Marshall Linehan described people with BPD as it's almost like they're third degree burn patients, and yet it's with their emotions. Like, in other words, when they experience emotions, it is so pain, they hurt. Okay. So, one of the reasons I think that I really love working with people with BPD, and I get it, I can connect with people, is because one of the pieces on how BPD forms, right? The biological piece, okay, is highly sensitive. Okay, like I'm a highly sensitive person. My daughter is. I'd be willing to bet my mom is. You know what I mean? Like it's being highly sensitive, right? Means that I was the kid that would get hurt feelings very easily, like as a kid. Like, oh my gosh, like someone would look at me like funny, and I would just be like, it would hurt. And people with BPD, okay, they feel things more deeply. When they feel things, it lasts a hell of a lot longer than people that aren't highly sensitive to emotions, okay? And and it lasts longer and it doesn't take them as long to be activated to feel that, right? So that, okay, now I was very privileged enough to grow up in a household that was very validating to me in all my different like quirks. Like no one I mean, like we all invalidate, but like my parents weren't ever giving me the message like something's really wrong with you, you know? You know?
Mhm. Yeah.
Um, so we have to understand that no one wants to be like no one wants to act like a crazy person. Like they don't. Like no one wants to act that way. No one wants to be that way. The people with BPD are so desperate for that relationship with people, right? That any kind of sign of potential like rejection or dislike or anything, it hurts them. Okay. And because they're experiencing that hurt, right? A lot of times people are like, okay, I need to fix this. Like, I don't like feeling like this, so I need to fix it. Okay. Instead of learning to tolerate it, and I need to fix it. So what fixes that? All right. That can be the constant, texting, like, where are you? Like trying to get the person back in because, like, oh my gosh, you're so important to me. I can't even fathom not having you in my life, right? Now, ironically, okay, that pushes people away because people don't like that, right? And yet that's like the last thing that they want. Okay, people with BPD are desperate. They want that connection, right? It's just that because of a skills deficit, they don't know how. Okay, because they were never taught. Because when they were growing up,
Mm.
or whatever, let's say they had a relationship later in life that was abusive. Like everything that they experienced emotionally was either told, "God, why are you so overreactive? Can't you be like your sister who doesn't react?" Or like they were taught like peace at all costs. So even if they were like dying inside, like, they had to put a smile on a face because, that's what we do. All right? So
Or one that gets me is dramatic. People say the word, they'll say, "Oh, I'm being dramatic." I
oh,
hear that word a lot.
yeah, oh, yeah, no,
Mhm.
I can too. And so my clients say that too. They're like, "God, I'm being so dramatic." I'm like, "Are you though?" Because what you're describing to me sounds very legitimate from why you're feeling that way, right? It's because people were shut down right away. Like wherever, whatever their environment was, the message that they received was, the way you're dealing with this is wrong. I can't deal with all these emotions that you're having, so you need to stop. Okay. So as you progress through life, it's like they're experiencing all this shit and they're like, I don't know what to do with this. So that's why people, okay. So like, okay, so I'm gonna go on a spending binge because that gives me a brief moment of relief. Or, ooh, I'm gonna cut myself because that gives me a brief moment, even though they immediately regret it afterwards, right? It's that, and that's where the behavioral reinforcement comes from, right? Because manipulation is a huge word that goes around, right? About people with BPD. The last thing that people with BPD want is to push away, is to not have this person in their life. Okay. Um, Sometimes the thought of not having the person in their lives is that painful that they themselves will put up a wall because, hey, at least I'm not going to be the one that's rejected. Because to think that you might reject me is going to be so painful that I'm going to do it first. Right. Like this is not a calculated thing. Like this is something that has been learned and done over the years because that's how people protect themselves.
I want you inspired one more question before the
Sure.
final question. What do you what would is there any advice you would give to people who are friends or family members of people that they suspect might have borderline personality disorder, or people that just have they're seeing have, not everyone thinks so clinical, so it's like just having extreme
Oh
reactions
yeah.
that they're interpreting as extreme. Is there any kind of like advice or anything that you have or any thoughts that you have on that?
So I'm gonna kind of go back to this acceptance and change piece, right? Well, yeah, okay. So here's the biggest thing, in my opinion, right? We need to assume that everyone is doing the best they can in that moment. It doesn't mean that they can't do better. It does not mean that they don't need to change it. Okay. In DBT, we assume that everybody wants to be happy in their lives, right? No one wants to be miserable. That I truly, truly believe that. Okay. So when people are engaging in behaviors that are like, ugh, you don't want to be around it, right? You first need to realize, okay, this person's doing the best they can. Okay. And you also don't want to be a verbal punching bag either. Okay. It's important to let people know, like, I don't like when you do that. Okay. It's not about it's not about sheltering people with BPD from hearing things they don't want to hear. Okay. It's about, hey, I love you. And I don't like when you did that. Does that make sense?
Yeah, that's super clear, and yeah, I actually really like the way you said that.
Thank
Um,
you.
and also, and now that I'm thinking about it, because it's so simple. Um, yeah, I love you. I don't like the way that you did that.
Hmm.
So I want to ask you my last question. First of all, thank you so
Oh
much.
my gosh. Thank
Like
you.
yeah, I could talk to you for a while, I think, but yeah, anyway, so it's not like a compliment smoke blowing up the ass hour. I'm just gonna ask you if there are one thing or a few things that you think people should know about kind of the work that you do. Is there anything that's coming to mind? Is there anything that you feel like they should know or And no pressure.
No, 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 I'm trying to think because there's a lot. Can you give me a little bit of a like, so I don't, because I could tell you a lot of stuff. I just
Yeah. Yeah, I'm thinking like, a lot of topics, are can be pretty broad and there's a lot of information there.
Mhm.
I'm curious about, like, is there something that's sticking out to you that you feel like, okay, people need to know this or they need to be aware of this? Um, yeah, when it comes to kind of like the population that you work with.
Okay. No, that's kinda that helps, narrow it down. So people with BPD, like, they're scared shitless that they're gonna be like this forever, okay? Like, no one is doomed to be borderline the rest of their lives. They're just not, okay? The people that I work with, and for the record, I don't, my whole caseload is not people with BPD. Sometimes people think they have BPD and they don't, or, like, sometimes it's trauma anyway. The people that I have that I worked with, and completed DBT with me, like, they don't meet criteria anymore for BPD. Okay, so, like, it's pretty fucking amazing. You know? The thing is, though, you need to find someone that you need to find the best fit for what you're looking for. Do you know what I mean? I kinda think I'm great at what I do, but I might not be that person for that, for a particular client, right? So the idea, I think it needs to be a good fit. And bottom line, people are not doomed to be borderline forever. Truly.
Yeah. It's interesting that you say that too, because I was just seeing, that a lot of people with BPD that meet criteria after treatment no longer meet criteria for BPD.
Yeah. I mean, again, it
Mhm.
doesn't mean that it's like a be all end all. You know what I mean? It's like it
Mhm.
might lessen. It just so happens that the people I've worked with, like, I'm doing my aftercare summary for my records or what. I'm like, and I tell them, like, we often look at what they brought in when they first started working with me, and we did the work. And like, you realize you don't meet criteria anymore, and people are like amazing. They it brings me so much joy because it's it is treatable. It's not an easy treatment, because it's a lot of commitment and a time commitment, financial. It's a commitment, and yet when you've tried all this other shit and you're desperate, like, people often find DBT as their last ditch effort, and it works though.
Yeah. Maybe it's a little bit of that, like, gift of desperation there at the
Mhm.
end. I heard that the other day, and I was like, "Gift of desperation? I'm gonna take that forever." Sarah, thank you so much for chatting
Oh,
with
thank
me.
you.
Really, thank you so much. I'm really, yeah, excited about the work that you do, and it's really cool to hear you talk about it with such passion. Um, yeah, no, really, really, thank you for what you do.
Oh, and thank you for having me.
And thank you for chatting with me. Oh my
Oh my gosh, I
gosh.
love this kind of stuff.